How do you take care of the elderly? Well, some of the intervention or action that we can do to care for the elderly are visit often. It is important to visit that often. They need the social interaction so they don't feel alone and may have depression problems. Check their medication. Be sure that they are appropriately supplied with their medication. Be sure to ask the doctor or pharmacist about potential side effects or possible interaction with current medication. Make medication in their home, installing a ramp for wheelchairs or wheelchairs, installing handrails and grab bars at the toilet and shower, checking the overall lighting in the house to make sure it is bright enough, making sure they are not skin mats or streets in the shower or bathroom or any other protection sleeper areas of the house. Supply healthy meals. It is important that they are well fed in order to stay healthy and prevent disease. The food has to be attractive to the elderly and varied with the nutrients that the elderly need. And regular exercise keep them active and that this will help them to be healthier and stronger. Perform mobilization and change of position to the patient to avoid pressure ulcer, strengthen motor and cognitive abilities through recreational therapies and occupation.
Also, also the question, how do you take care of the elderly? There are so many and diverse types of cars that promote the relation and health of the ancients. You have to know that good hygiene of the sick elderly. As well, it is important to feel well and maintain a good image. Take special care in cleaning and dental hygiene. This affects the correct diet. Carry out needed assessments. Assemble a good team of professionals to support. Generally, and elderly persons present various pathologies. The most advisable thing is to have geriatrics who can guide them as a family in the care and treatment of the trait relativity. In an elderly person, the risk of accidents increases as their senses begin to diminish. We recommended working a list of some risk factors and taking actions it's read here. Provide the affection items and details and the end of the day. The most important thing is affection and love that we can give it to family member. Perhaps there will be material needs that are difficult to meet, but the time, details, and affections that with them every day will make them feel happy and participate in social activities, keep your environment safe.
What is one of the biggest problems with elderly people? One of the biggest problems for elderly is lost their dependency to be able to move around the house or carry out their daily tasks because they do it with difficulty. One of the biggest problems is falls inside your home, health problems, poverty, of low social protection. The elderly become vulnerable to more disease and to life in risk situation, either due to personal economic resource or the family environment itself. However, I think that the biggest problem of the elderly is the loss of independence, since it affects an aspect of life.
The early constitute a risk group in some diseases that are usually related precisely to aging. They are what we call chronic diseases, such as diabetes, hypertension, and mental illness, cardiovascular disease. Psychosis in the elderly constitutes a heterogeneous group of primary psychiatric, neurodegenerative, vascular, or affective, which results in a disorder of the content of thought, sensory perceptions, and behavior.